Welcome back to the channel. I'm Dr. Dustin, board certified dermatologist. We are looking at pimple popping reactions. We've got a few lasers today and we're gonna have some fun. If you're new to the channel, I'm a board certified dermatologist and we watch these because I also teach you about how to take better care of your skin as we go along so you don't have problems like these. Let's dive into the first video. First up, we've got some extractions here. These look like sebaceous filaments. And I think we're right on the nose, maybe the chin, hard to tell exactly from the zoomed in angle that we have, but we got 4 of them here. They're telling us from blemish bandits. They're coming out nice and easy. Probably did some chemical exfoliation before they went in here with the tweezers, and they're just pulling these out nicely. Again, sebaceous filaments are normal. We don't have to remove them, and they will come back if you take them out. 3 out of 4 here. Let's see if we can get it. It's not coming quite as easy as the others. You see those little fine vellus hairs? These are hair follicles. Your oil glands are attached to a hair follicle. And let's see what the last one's gonna be. Oh, we're still going after this one. Okay, there, pretty much got it now. And the last one, boom, that one came out nicely. Next up, it looks like an ingrown hair, a little bit of a cyst jumping in there too. Yeah, oh, they got most of that out in one pull. Now go in, let's get the hair out. Blemish Bandits always does a good job here. Got a bit of an ingrown hair. You see that the hair follicle keeps producing those dead skin cells. There's oil in there, and that's all the other stuff that's tied up around that hair. And they're being nice and gentle with the skin. We're really zoomed in so we don't see if they have gloves on or not. I'm assuming they do. Let's give them the benefit of the doubt. Getting a good hold of it. It's coming. Just teasing it out. Let's get down there and get it. This patient is having a laser procedure done. We can see that they're getting some redness on the skin after they cover the area with the laser. It's not leaving holes in the skin, so this is not a CO2 or an erbium laser. This is passing through the skin and the energy is tightening the collagen underneath. This can be done for acne scars. It can be done for skin rejuvenation. And they're probably going to be red for a few days before that wears off, and the results as that collagen improves can take anywhere between 3 to 6 months, but the biggest results should be seen in the first 6 to 8 weeks. Next up is the laser carbon facial. These are always so satisfying to watch. They put the carbon lotion on the skin. It's a little bit spicy. You can see her flinch a couple times, but this can help to reduce oil on the skin. It's not a big change, but it feels nice. It tightens the skin temporarily. And it's something that you can do a little bit more frequently because it's not super traumatic to the skin. This patient is having some acne scars treated, is what it looks like. We see the holes being put in the skin, so this is an ablative laser. Erbium or CO2 are the most common. This little yellow thing at the top of the screen is a smoke evacuator. Because this targets water in the skin and it instantly vaporizes that tissue, there is a plume of smoke. You don't want to breathe that in, so we always use something like a smoke evacuator to get that smoke out of there, and we don't have to breathe it. Next up, we've got some extractions from Sac Dep Spa. They're always good. And they're squeezing on these. They're using a little 11 blade to kind of open it up and help these to come out easier. They're wearing gloves, which I like. They probably cleaned and prepped the skin appropriately because this is being done in a professional setting. I always wonder, like, what are these people doing to care for their skin or not? Like, it just do something and your acne doesn't usually end up this bad. But it can, and they get treatment. I just hope that they're going home with good skincare to prevent the problems from all coming back. And I thank them for going to Sac Dep Spa so we can all appreciate these extractions because they're always so good. Oh, I love that one. It's a big juicy one. Love it. We've got a lot of whiteheads here and some sebaceous filaments. We see some blackheads. They're just squeezing on them. They always use this 11 blade to kind of loosen up the top of any stubborn ones so they come out more easily, and then they just scrape them away. Kind of store them on the glove there, and you can see all of them at the end. Some of the most satisfying videos from Sac Dep Spa here. Just very congested skin. What would I give you? Salicylic acid, retinol, but you need to do these extractions. When you get this congested, you've got to get that stuff out of there if you really want to see significant change in the skin. That's why these procedures can be helpful with an esthetician or a dermatologist, and then getting on the right skincare will really help to keep your skin healthy after that. Generally, it's just the squeezing can be a little uncomfortable, but they're not poking that blade in there enough to really do any damage. As we watch these, I'm always telling you guys what kinds of products that I would recommend to treat your skin with that you don't get this kind of acne. The product I want to feature today is Differin Gel. This used to be a prescription, and it is a full-on retinol. Not a retinol, not a retinaldehyde that has to be converted in the body. This used to be a prescription-only retinol. You can now get it over the counter, and I will have a link down in the video description. If you're going to use retinol in your skincare routine, wash your face at night with a gentle cleanser, and then once your skin is dry, pat dry, air dry for a few extra minutes, take a pea-sized amount, and that's all you need to cover your whole face. Dot your forehead, chin, cheeks, and nose, and then rub that in. After a few minutes, go ahead and apply a moisturizer so you don't get the dryness and irritation. Using a retinol, I recommend starting out just 2 to 3 times a week, and then slowly you can build up to daily use. Retinol, Differin Gel, you can find it down in the link in the video description. Now let's go back to our videos. Right under the eye, a lot of blackheads here. And just kind of mashing on them, using the gloves, loosening them up with the 11 blade. That's a tall one. You got a lot out of that guy. These blackheads, this oil of the skin, when it gets exposed to air, it oxidizes. And that's what makes them look black. Because the material itself that is produced is usually white, but the oxidation causes it to turn dark. Plenty of them to get here. And they just keep going. Just keeps going. For your viewing pleasure. And mine. Today on Pimple Pop Glory, we've got a guy here, he's got his camera position and a cyst behind the ear. Hopefully he washed his hands before this. Holy cow, Did you see how far that squirted? He's looking like, where did that land? I did not expect it to squirt straight out like a fountain. Holy cow. Like, where did it land? Who's going to clean that up? He's got the toilet paper. And of course, in this location, the chances that that's going to fill back up, pretty high. And you've got to be careful mashing on them so hard because you can actually create scar tissue, and then surgically removing them becomes more challenging. I think he's looking to see what that hit. Like, where did it go? Yeah. We're shocked too, buddy. My first cyst. Congratulations. We're here to go through it with you. Oh, it's tender. You can see how red it is, and this is deep. Oh, it's squirting like right on the phone. Ah! Oh, that looks painful. And now the blood. Yeah, that's time to stop. Time to stop. We've got what looks like a blackhead here. No gloves. Hopefully they wash their hands. I don't know if they're doing this to themselves or if they're helping a friend out. And just a little sideways pressure. The point of the nail going to be a little more tender. Ooh, there we go. Yeah. Thank you so much for watching the video today. I hope you guys enjoyed this as much as I did. Some really cool ones, some gnarly ones, a few lasers, which I always like working in because I do a lot of lasers in my practice. If you guys have any questions, ask them down in the comments and I'll try to answer them, and I'll see you guys on the next video.